somebody joins us, they'll join us. So I will introduce Kristin. I know it's kind of an unusual topic for our Kiwanis meetings, but Kristin is a local business owner. She has the Veterinary Dermatology Consultation Services on Merle Hay Road. And I've always been pretty curious about, I worked for a dermatologist, a human dermatologist for about 8 years. So I've always been curious about veterinary dermatology. So I invited her to kind of tell us a little bit about what her business is all about. So I'll leave it to you, Kristin.
Well, thank you, Barb. And I want to mention too that where I'm located right now, I did buy from Pathway Church. So I see Dan here, familiar face, passing along the building to me and allowing me to pursue my own location. I did have a business before that, but just not at my own location. I was seeing patients through IVS and IVRC, now Blue Pearl, so the two emergency hospitals here in town. But basically, I started out as a veterinarian in general practice for a couple years, but I quickly found out that a lot of what presents to a veterinarian, probably about 30% of my caseload was all related to skin and ears. And unlike a lot of veterinarians, I really liked it because to me, it was like a puzzle. First of all, I could see what I was dealing with. And second of all, there's a lot of detective work that has to go into what's causing it. So I decided to pursue residency, and I did that out at the University of Pennsylvania. At the time, I was working in the Chicago area as just a regular vet, and then went out to Pennsylvania, 2-year residency, took boards. And by the way, it's a grueling 2-day, 8 hours each day of boards testing. So got through that, passed my boards. Went back to Chicago area, and then we moved here in 2005. I went to school at Iowa State for my veterinary degree. Yay, go Cyclones. And my husband was, I met him at Iowa State. He's from Iowa. So coming back here was a good move for us, as our children were, we had 3 kids at the time, and it was hard to work full time and watch the kids. So I stepped back and actually worked at Iowa State in the vet school for 2 days a month just to keep myself into it while my kids were little. And we welcomed twins shortly after we moved here. So we have 5 kids. So I continued that small little business that I had for a couple of years, and then went on to work locally a few days a week. So anyway, 2015, bought the building from Pathway Church, and we turned it into quite a nice more space than we probably need, but it's a nice spacious practice that we have built up. So anyway, I take referrals from the area vets. Basically, I deal with dogs, cats, pretty much with skin, mostly allergies, but all kinds of skin diseases, ear infections, foot problems, anything basically that you can see on a dog or cat. That's what I deal with. And I take referrals from all over the metro, and now expanding to a lot of different parts of Iowa. So that's pretty much my client base. This year, it was kind of ironic. A position was offered to me at a national, actually international veterinary lab called IDEX, and it's one of the 2 largest veterinary labs in the world. But right now, what I also do is consult with veterinarians all over North America, basically, on skin cases. So that position was offered to me, ironically, before the pandemic. So in February last year, traveled to Maine, where the headquarters are, and spent 2 weeks in training. Came back here right before the pandemic hit, and it's a work from home virtual job that when I interviewed was part-time, which I thought would fit in nicely, until I found out part-time was 32 hours. So I consult from home 32 hours a week, and then I still see patients at my clinic, but on a reduced basis, about 10 hours a week or so. And actually a lot of those hours actually are participating in some clinical trials. There are lots of, the pharmaceutical industry is really really active right now with allergies in dogs and cats. I'm participating in some of those clinical trials. So if you know of anybody with dogs, primarily with itchy skin, licking, scratching, I can both help out with, the normal veterinary stuff. But if anybody's interested in clinical trials, you know anybody that's looking for help, but maybe wants to go that extra step or doesn't want to have to pay for their services, we've got some clinical trials going on for those kind of things as well. So that's kind of it in a nutshell.
Have you had an unusual animal that you've treated that was not a dog or a cat?
That's interesting you asked that, because when I worked in the Chicago area, I did once in a while, not often, but once in a while, I would go down to the Lincoln Park Zoo and I would help out with some of their difficult skin cases. And on one occasion, they had a sloth that was losing hair. They had a bear that had allergies. I think it was a Kodiak bear, if I remember correctly, and then a seal that had fungal disease, and it was largely because they couldn't afford, or they were trying to cut costs and they weren't using salt in their water. They were using more of a fresh water, which made the poor seals more vulnerable to getting fungal infections. So that was kind of interesting. So yeah.
Park Zoo, do they use you?
I'm sorry, what?
Does the Blank Park Zoo call you for anything?
No, they have a good relationship with Iowa State, so there are dermatologists up there if they need that kind of help. So I won't step on their toes.
Do people come to you directly, or you only take referrals?
No, I have some people come directly. I always involve the referring veterinarian or the regular vet those to keep them in the loop. And I have a good working relationship with the vets in the area. So sometimes their vet won't mention it because as I'm noticing on even my consultation line that I do, sometimes veterinarians just assume that you're not going to want to travel or do that extra step or anything like that. So sometimes it's not mentioned or thought of. But if somebody decides to see me on their own, and I reach out to the vet, I don't typically have any pushback with it. So I would say if you have a question about seeing, you're interested in it, it's always good to get your vet in the loop and say, hey, I'm thinking about, going to see a specialist. Usually they're pretty open with it. Even if they're not, I will never turn anybody down because their vet we don't have insurance to deal with. So it's really your choice.
That's true. Yeah, that is true.
Yeah.
Don't
And one
people
thing
have pet insurance?
There is pet insurance, and I will say the people that have it, it's really helpful. And I will say from a veterinarian perspective, we really like pet insurance because it's not at the point where it's a pain like it is in human health to deal with. It's still a third-party payer type of thing. But it is really nice because it takes the pressure off of us when we want to do something. Money doesn't get in the way. It's like, yeah, go ahead and do it. I have insurance. So for now, it's a good
I have a
thing.
dumb question. You mentioned dogs that might have allergies or scratching. I have a dog that scratches all the time because I think she likes it. How do I know that the dog is scratching because she likes it as opposed to scratching because she has an allergy?
That's a really good question. And everybody
That's the only kind I ask.
That's a really good question because even we might have a scratch every once in a while, right? You just, doesn't really mean anything. But if a dog does it habitually, or it's annoying you, or it feels like, you're saying, hey, stop it, that's when it's a problem. Or if they're scratching and they're really kind of moaning as they're doing it, and you feel like, oh yeah, they're really, they're hitting the spot. That's usually an issue. And one thing that's really a misunderstanding is licking paws, because to some degree, licking paws can be normal if they're dirty and they lick a little bit. But if it becomes where they're doing it many times a day, or if they're just sitting they're really gnawing at it, they're really getting into it and you hear it. I feel like if it's annoying you, then it's annoying them. That's probably a good benchmark.
That was my next question, because we have a grand dog that licks his paws constantly.
Yeah.
Constantly. Yeah.
Yeah. That oftentimes dogs get yeast infections in their feet from licking. It's usually allergy related. So that's a common thing that I deal with and something that's oftentimes overlooked.
My daughter says her cat has yeast infection in her ears. Is that possible?
Yeah.
And they've tried to doctor it or whatever and don't seem to be having much luck. So I don't know.
Yeah, cats and usually when cats get yeast infections, it's not as common as dogs, but again, a lot of times it's allergy related, and we start seeing it now. Like even I have to admit, my own cat's scratching his ears a little bit right now because as the weather gets warmer and windier, those things get stirred up for sure. Yeah.
You had a question?
Did you have a question? Yeah, Polk?
Yeah, thank you. Because I'm sure that with all that licking, you take in hair and you ingest hair, and now that is internal, and now that creates blockage.
Sometimes in cats more than in dogs. And in cats, it even depends. Some cats can pass it quite well. And other times it just depends on their digestive system. That's why they get hairballs. Consequently, there's food out there that helps with cats that can't digest their own hairballs. It's basically more fiber.
Okay.
But with dogs, we don't really see much of a problem with that. It's interesting.
Okay.
You'll see it on the floor, though.
Yes, you will.
Yes. Yeah.
Kristin,
One thing that, go ahead, Dale.
how often do you actually see the animal? Do you see them frequently, or is it mainly just talking to other vets and going from there?
Yeah, that's a good question. I certainly like to work with the primary veterinarian when we can, because I mean, you spend a lot of time building up a relationship with that vet. But having said that, I do have a lot of people that I've seen from the early days, and I keep managing their skin problems, or they want to keep coming to me for the skin problems, and that's fine. And I think that's welcomed a lot of times by veterinarians, because skin issues tend to be complicated and take a lot of time. And the general veterinarians have a lot of other things on their plate. So sometimes I feel like that's welcomed, that I can take that off their plate, but we can go both ways. And I will say one thing that COVID has brought is it's loosened up regulations for telemedicine significantly. And a lot of us veterinarians have, in a medical side too, have brought up telemedicine as an offering. And that's one thing that I've embraced and started, because I actually closed for a good 3 months during the early stages of COVID. And that was a nice way to continue that. And I have a lot of people that are seeing me for the first time. That's my new workflow, basically, is our first appointment will be a telemedicine to do a one-on-one consultation. It brings back that face-to-face thing without masks. And I get to review the records, and I get to come up with a game plan and just say, hey, this is what I'm thinking. And that also gives the owner some time to think about it. And then we just turn that into a scheduled curbside diagnostic appointment, basically, where it's pretty quick. I just go out and get the dog, bring it in the office, and we do skin scrapes, or we do a blood test, or things like that, and then go on from there. So it seems like it's helped with efficiency. I think that's our silver lining. And people that are farther away and maybe don't want to travel.
Ask you, are there other veterinary dermatologists in the central Iowa area?
Yeah, not very many. Like I mentioned, up at Iowa State, there are 2 there. And then I'm the only one in central Iowa. There is a dermatologist part-time in eastern Iowa, I believe Cedar Rapids or Cedar Falls, somewhere up there, farther eastern Iowa. And that's it for Iowa. And nationwide, I think we're maybe up to 300 or 400 in the country. So not too many. But there's a demand. I've heard when I talk to veterinarians across North America, usually they're talking about they want to refer the patient, but there's a 3-month wait, which I don't experience here in Iowa, but a lot of places in the country that is the case. So.
had a dog that had a itching problem, and back in the day, I guess, and they ended up switching to a pretty expensive kind of food, and then he quit it. So
Yeah, there are some really good prescription diets out there, but they do come with a price. And I will tell you, one of the factors, this was interesting, for dogs with food allergies, to put them on a hypoallergenic diet, that food, before it's made, the company, whether it's Hills or Royal Canin or whoever, they go through and clean the whole manufacturing line. And they said it's about an 8 to 12 hour process to clean the whole line so that there are no traces of other proteins in that food. So that's just one part of the expense that you figure that's a lot of downtime for a manufacturer.
right. Right.
When I worked for the dermatologist, we dealt with a lot of skin cancer.
Yeah.
Do animals get skin cancer?
Yeah, another good question. Not in the same way. We do get some, primarily because there's not as much sun exposure to them. So we don't have that issue. Melanoma is not very common. And when it happens, it's about 50-50, whether it's malignant or whether it's benign. We do get cutaneous lymphoma. That's another skin cancer that looks like infection oftentimes, crusty skin in older dogs. That is on the rise. We don't know why, but that's probably the most common form of skin cancer we see. Down south in the really sunny areas, southwest, they see more squamous cell carcinoma, which is a type of skin cancer where it causes ulceration, it causes eating away of the skin, mostly on the face because it's less haired. But the basal cell, just not that common in dogs. So it's interesting because I have been to some human dermatology conferences, and there are a lot of similarities, but also a lot of differences. And we went to the human dermatology rounds during my residency and did a lot of comparative derm. I think certainly being a haired animal is a lot different than a less haired person. and a lot of parts of veterinary medicine, things are very similar. But there are, probably about 50% is similar and 50% is different, I would say, in dermatology. So, yeah.
Psoriasis or dermatitis, that kind of stuff is not.
Yeah, the most common things that human dermatologists see, acne, psoriasis. We just don't, other than, puppy with some acne, it's just not the same. It's not the same disease. And psoriasis, we don't really recognize in animals. We do have some things like the type of pemphigus the dogs get. And I might be speaking specifically to Barb here in that world, but some of the autoimmune things like pemphigus, it's a slightly different type of disease, but we have that. We do have eczema is basically what I treat for allergies. I mean, it's probably the most similar thing. It's a lot. Most dogs, I will say this, the difference between dogs and people with allergies, people get hay fever and itchy, watery eyes, nose, coughing, asthma. With dogs and cats, it's pretty much the similar type of thing to eczema. It's basically skin itchy, more of a skin presentation. So I am the allergist in the veterinary world. I'm also the immunologist in the veterinary world because we deal with all of the autoimmune type of diseases with that. So.
Do people ever just take a
ENT.
picture of, like I'm thinking of my kids' bloodhound, has something weird on his face right here. Mm-hmm. I said to the kids, what is that? And of course they both work. They have 3 kids. She's pregnant, and taking the dog to the vet is unfortunately not top priority.
Right.
I said, oh, that you were speaking to us. And I said, I wonder if he'd ever take just a picture of that and show it to her, if they can say, yeah, that's just nothing, or yeah, you should really take him in.
Yeah, that's basically what my telemedicine service is like. We do the face-to-face talk, and I can also see the pet through the video. But what I do recommend ahead of time is that people send me close-up pictures because that's much easier to see than a movie. I'm frozen. Am I better?
No. Yeah, you're not frozen.
Okay. Sorry.
but you're not.
As long as you can hear me. Basically, if we can do pictures ahead of time, that's a lot better than a moving camera, moving dog, all that kind of stuff. So yeah, absolutely. That's where it's been really handy. And about 50-50 of the time I can say, this is most likely what it is. And maybe we can even proceed with treatment. And the other 50%, we need to see this in person. I need to get my hands on it and do some microscope work and go from there. So absolutely. And the other thing with COVID is I've become very automated online, and some people love it, some people hate it, but I have all my booking engine is all online that people can book their own appointments, messaging, and it's really turboed us into the 21st century here.
Right.
For sure.
Oh, you're back. Did you have a question?
Me?
Yeah.
Oh. At the last moment, I was the only one that was moving. Everybody else was frozen. No, I don't have a question.
But you were frozen and we were all moving.
Is that a fact?
That's
Yeah. Yeah.
I think I'm going to go join another meeting. No, I wanted to ask the question about the human patient in hospital being approached by a veterinarian, and how did they feel?
That's a good, it was interesting because during those rounds, there were people that they would, I mean, this was not in the hospital, it was more in their outpatient setting, but they would have people come in and be in the exam rooms, and people would just, all the doctors and just a few of us veterinarians would walk from room to room and see, and it was a little unsettling because they would be in all different forms of dress, and so that was not what I was used to as a veterinarian.
Yeah.
And it was brave of the patients, I think, but that's what it was. But anyway, I don't know if they actually knew. We didn't interact very much. It was more like we had a lecture hall where they talked about the cases. It was very impersonal, to be honest. It wasn't my favorite thing, but they'd talk about the cases, and then the people would be in the rooms, and I guess you could ask questions, but there wasn't a lot of interaction going on. So I kind of felt like I felt like the poor people must have felt like they were in a zoo or something like that on display. But I mean, they didn't have to go, I guess. But anyway.
You didn't check their nose.
Pardon?
You didn't check their noses to see if they were wet.
No, that would have been entertaining. I think one funny story though, this is not related to directly that, but there was a veterinarian on some chat boards that was saying that she was helping out with the COVID vaccinations, and I think it was in around Vegas in Nevada. But they were telling her, you feel free to interact with the people that you're giving the shots to, like they talk, not like your veterinary patients. And so she was saying, okay, today is so she started telling people that she was a veterinarian, and they said, the good news is that at the end of this, you're going to get a treat and I'm going to rub your back. So I think that made people pretty, they made them laugh and lighten it up a bit. But I haven't had that opportunity here, so I can't.
I did hear where they were thinking about recruiting veterinarians, though, to do vaccinations.
I think we'd be willing to do our part. Absolutely.
Veterinarians
Absolutely.
and dentists, I think. So
if needed, I would help out for sure. Haven't gotten that call. Yeah. Any other questions?
thanks, Kristin. This was very interesting. Now, I do have a question. Is that really true about wet noses?
That's a little bit of a wives' tale.
Okay, I thought so.
Yeah. But on the other hand, I don't know that sick dogs, unless they have a runny nose, have a really moist nose. But a dry nose is not always a bad thing. Unless you're seeing the dermatologist, then it probably is.
Thank you for being
thank
here.
you. Yeah, thanks
Thanks,
for being here.
Kristin.
Good to
Thank
see you
you.
all. Enjoy the day. Stay healthy.
Thank you.
Well,
Thank you very much. Bye-bye.
Bye-bye.
Bye.
Peace.